I will say exactly what I've said in public presentations on this. I gave a presentation to a Eastern State Medical Society, and I said basically what I'm going to answer with you now. Physicians have to have long-term view. You have to have a longitudinal, long-term view of your decisions. You had to invest long-term to get to where you are. Don't take a short-term payment and give up a long-term future. That is what you should not do. So whatever the deal is, whether you're signing up with a hospital, whether you're signing up with a private practice that's independently owned or one that is owned by private equity, whether you're joining a Kaiser or, working for, CVS, or I don't care what this is, you have to make sure you're not tying one hand behind your back going forward. A lot of these entities have termination without cause clauses. Most of them do. Independent practices most often do not. They have restrictive covenants. Look at those restrictive covenants. They can really limit. You don't ever want to look at your spouse and say, we have to leave the state because of this restrictive covenant. Out clauses. Got to be able to get out. Columbus didn't burn the Nina, the Pinta, and the Santa Maria at the shore when he got to the New World. You can't burn the ships at the shore. You've got to have an escape route for yourself. And if the agreement doesn't give you an escape route, you better not do it because you're going to be stuck in a bad situation. And look at the organization you're going into and say, are they growing locally? Not are they growing nationally? Are they able to get other doctors to join them locally? Are they commanding their local service area? Do they have the best contracts with the health plans? Do they have a diversified revenue stream? Do they have a plan for a diversified revenue stream? Can you see yourself working in this place 10 years from now? So people will dangle treats out in front of you, but you got to make sure there's something beyond that treat that you're going to be able to benefit from in the long term.